Hello everybody, my name is. Sorry for coming late. Sorry for coming late. Sorry for coming late. Hello everybody, my name is Adewale. Sorry for coming late. Thank you, doctors. Sorry for coming late. Okay. Doki,
Yeah,
hello
hello.
sir. Sorry for coming late. All
No
is well.
problem, no problem. Yeah,
Nigeria
I
will be
understand.
great.
We'll keep praying.
If you hear some noise, that's the voice or that is the noise for generator.
Okay.
Okay, I want to reposition. Everything will still be okay. I'm working on a small studio so that
Oh,
my audience will be able to get one of the best, the video quality of my own side. Are you there?
yeah, I can hear you clearly.
Okay. Thank you, Doctor. It's good to have you on the show. Thank you. Thank you. I'm very grateful to you. Doctor, please can you introduce yourself more proper to our audience? Are you there?
Yeah, I can hear you clearly. My name is Osazuwa Igudaro. I'm
Doctor
a
what?
I'm Doctor Osazuwa Igudaro, but everybody knows me as Osas. So I am
Yeah.
a doctor licensed to practice in Nigeria as well as in the UK as well. So
Thank you, thank you, thank you, thank you. I did not take this opportunity for granted.
you're welcome.
Doctor, since when you teach us to take more water now, I have been taking more water.
That's impressive. That's very
But
impressive.
my problem is that I've not have time to go and check my VP. I will go and check it tomorrow.
I mean, you should take our time to do that. It will help.
I will. I will. It's because of this program I'm putting all efforts. By the special grace of God, so next month we are going to have a very good time, a lot of content. Doctor, the floor is yours.
Oh, okay. Okay. I just saw one of my colleagues. Good afternoon. Good evening, everybody. Sorry. So I
Any
would
good
be.
shot?
So I'll just talk briefly about diabetes. I remember vividly the topic is let's discuss diabetes. I'm actually open to your questions, and I'll try and break it. In fact, they'll probably use pidgin English to probably break it to
Oh,
language
joy.
so that everybody will understand. Okay, so briefly, it's diabetes mellitus, and many of us would say diabetes mellitus. The person get diabetes. Bulk of the people that have managed over the years have actually had diabetes, and we had to treat them in the long run. But what is this diabetes? And as I said, at the end of this discourse, I'm open to questions, and I would be able to answer by God's grace. So, what is diabetes in itself? Diabetes is actually what we call the metabolic condition, meaning is a wahala in the body, whereby there is an abnormality that affects primarily glucose, but also affects other biochemicals in the body. And it's responsible for the person not to be able to take in and appreciate the glucose in the blood. So that's when they now have high blood sugar. So if I were to give it in the normal definition we give, we would say diabetes is when there is a derangement, is a metabolic disorder that is associated with absolute. That is when there is no, or when there is nobody, or when there is insulin, but the body cannot use insulin at all. Two instances. There is insulin, but the body, which now all other biochemicals in the body. And these chemicals I'm talking about is the glucose, that's carbohydrates, the protein, as well as the lipids. It's really sad because it's really a big issue in Nigeria because many people have diabetes and they are not aware, or they are aware but they are not taking necessary precautions. So they come down with complications of diabetes. So I'll just give you the fact that the major issue is the major issue about diabetes affect all other systems in the body. That's why when we are talking about the complications, when we are talking about the complications, it's a lot, starting from up down to the other parts of the body. So just to portray this fact, it has a myriad symptom. But before then, there are types. The commonest types that we talk about in the Nigeria context is the fact that we have type 1 and type 2. Now, type 1 diabetes is generally when there is no insulin at all. And I remember when I was telling you about the definition, when I discussed the definition, I talk, say, you get time where person not get insulin at all. So that one is usually type 1 diabetes. And there are times when there is insulin, but the body cannot use it. And that's all called type 2 diabetes. So you see, one, no insulin, the other one, there is insulin, but they're not the reason. So there are other types. The other ones are the ones associated with pregnancy. That's what we call gestational diabetes mellitus. That one is, of course, pregnant women. But thankfully, sometimes it resolves on its own. Sometimes it doesn't. But we will just talk briefly on that. So the major symptoms that patients will usually present with is they'll be drinking a lot of water. They'll be urinating excessively. And they will usually be hungry. And when they are usually hungry, they will usually be eating. I can say your water. They will usually be eating, but they will be noticing that they lose weight. Those are like the three commonest features with diabetes mellitus. They are very common, and a lot of people have this. But I could just give you insights to the risk factors. So what are the risk factors to this? What can predispose me? Which if it cause and make I get diabetes? Is it like I just wake up one morning and get diabetes? There are many risk factors to diabetes. You know, when I talked about hypertension the other day, I talked about the risk factors for hypertension. I talked about diet. Now, some of the risk factors for diabetes are similar to that of hypertension. But top amongst those is the family history. If there are people in the family that have diabetes, I've had patients that their family, maybe their dad or their granddad had diabetes. It increases their risk of having diabetes. So they need to watch it. You understand? So family history is a great risk factor for diabetes mellitus. Other risk factors include physical inactivity. If it is you just keep sitting down, not doing anything, you're not engaging yourself, you're not exercising, these are risk factors. When you get to sit down all day doing just on the system, doing all that stuff. Another risk factor is obesity. I categorically have to say this. You know, I worked somewhere in Nigeria where out of 10%, out of 10 patients that I see daily, 9 of them were obese and 1 is going to be overweight. I mean, do you understand? So there are people anywhere, they'll say anywhere belly face na front. Just keep consuming. Where the people say that there's hardship in Nigeria, even with the hardship, oh, I need shawarma, give me pizza, give me this, give me that. They just keep eating. I'm enjoying life. The next thing I'll hear is allow me to enjoy myself. Also, we'll tell you that this is life. Now they want life.
We're not kill ourselves.
But don't that you don't want to kill yourself doesn't mean you increase the risk of you having conditions that would kill you in the long run. You understand? So obesity is a major factor that people need to put at the back of their mind. Then there are other things. For ladies, there's what we call polycystic ovarian syndrome. There's when there's some sacs with water in the ovaries of these women. It increases the risk of them having diabetes mellitus. Then diet. I've talked about diet, which increases the risk of having obesity. And this also at the risk of causing, increase the risk of having diabetes. So my appeal to everybody that is hearing me on this, or that will hear me in the later on in this conversation, my appeal is please watch your diet. That a food is good or is appealing to the eyes does not mean it's good for your blood. Does not mean it's good for your system. Does not mean it's good for your stomach. Please. It's sweet, I agree. It's delicious. It's tempting. Even me, I fall into the temptation. But my appeal is your health is very important. So I just giving you just a brief insight into this. But another thing people would say, please, when you say, doctor, if I take too much of sugar, now I will get diabetes. No, 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 no. It's just something that people like to say, but it's not true. It's just like when they say you take too much of, when they start telling you about typhoid and malaria, I'll boldly tell you typhoid and malaria, all those, is either you have malaria or you have typhoid. They are two different conditions. It's either your malaria was not poorly treated, that's why you have malaria. I have to say this now because many of my colleagues who are here and who have seen this video, they know that we get to face this a lot. Doctor, I just get malaria. I can't get typhoid. The typhoid, don't shoot me, shoot me, shoot me, shoot me. No, bros, you didn't have typhoid. All you had was poorly treated malaria. But that's just a digression. Sorry about that. So I was just telling the fact that taking too much sugar doesn't. But it increases, all these things I've stated increase the risk of someone having diabetes mellitus. And the commonest one that we see is type 2 diabetes mellitus. So the question is, what do we do when a patient comes with diabetes mellitus? The first things are usually lifestyle. Lifestyle modification is the top on the list in managing patients with diabetes mellitus. Lifestyle modification. So it's important that you watch your lifestyle, what you eat, exercise. It can never be overemphasized, the fact that you need to exercise as much as possible. It increases your risk. It helps reduce the risk of many health conditions across board. Diabetes, hypertension, obesity itself, many conditions. So exercise is a very key thing. Then drink a lot of water. Alcohol intake has not been, it also increases the risk. So when you take too much of alcohol, it increases the risk because it can overwork your liver and it can, in the run, have a lot of downturn effect on the body. So your diet is important. Please take a lot of fruit and vegetable. I keep saying it that Nigeria is blessed with a lot of fruit and vegetable sources. When I was in Abuja, going to Kubwa Market, they sell fruits. Particularly when I was up north, I get fresh fruits, fresh vegetables, and it helps. It's not every time you just have to fry. It's not every time you have to shawarma. I know some people are going to tell me that. Some people will tell me that, doctor, they want me. Yeah?
You like fresh food. You like fresh food.
Just take it fresh. It's important. You understand? So these are things you should do. And if perhaps you notice that you have these 3 key symptoms I mentioned, you are urinating excessively. Not because you are drinking too much water, but you are urinating excessively, you are drinking too much water, you are losing weight despite eating a lot, hungry, please go and see your doctor. There are medications that we can give that would help to, if it's type 2 diabetes mellitus, for example, there are medications we can give to increase your body's sensitivity to responding to the insulin you have. However, if it is type 1 is commoner amongst children. It's commoner amongst children and other conditions. If it's a type 1, we can give the patient insulin. Some patients are on insulin therapy for a long time. So it's important that you go to the doctor, get your sugar test. Now, if perhaps you already have diabetes, it's important that you know this, that the sugar machine is not expensive. I bought my sugar machine when I don't have diabetes, but I had the sugar machine back then in Italy. I believe is it 3,000 or 5,000? It's not so expensive. And moreover, to even check your blood sugar, I know some people do it for 100, 500, 200, just to check it. There's what we call a fasting blood sugar. Fasting blood sugar is done before you eat in the morning. It can give you a picture of what is happening. Then you can also do a random blood sugar, which is done anytime. I don't know whether I'm passing. Am I making sense? Are you flowing, sir? So
yes, the point I'm with you.
If you have diabetes, please ensure you take your medications. Ensure you watch your diet. There are people who have lived with diabetes for a very long time. In fact, you don't even know, it's just normal. They watch their diet, they watch what they eat, they take their medication when necessary. And this has gone a long way to help them to have complications of diabetes. I'll just give you briefly some complications of diabetes. It could cause stroke. It's one of the risk factors for stroke. So stroke might not be village people having meeting. It might actually be the fact that you don't manage diabetes properly and now you have that stroke. It can cause blindness. Some patients with diabetes, they have what we call diabetic retinopathy. They have blindness from diabetic retinopathy, and it can even worsen. If you come to the heart, it can cause the one that we call heart attack. Some of these heart attacks that we have, some of these people that die from, the patient just have heart attack and he don't die. It could be as a result of diabetes in itself. Because diabetes will cause a lot of attenuation of blood and blood vessels, the pipe in the body that is transferring blood to the muscle of the heart. Because you're not controlling your heartbeat. Are you controlling your heartbeat? You can feel your heartbeat, yeah? You can't, but you can't control it. So because you can't control it, the bloods that are going there, there's blood going there every time. If they are blocked, the heart muscle is gone and voila, burst. You say 2 minutes, everywhere burst. Alright, so aside, if you go to the stomach, it causes a lot of issues in the stomach. If it goes in the leg, now this is it. If we are diagnosed with diabetes mellitus and you find out that you have injury, we usually make an appeal that things it's not all injury that patients that have diabetes is going to be cleaning by themselves. Please, it should be properly cleaned and properly managed because it can worsen and you get to cut the people's leg. There are many patients that were about to cut their leg and just started with a small injury that spread and kept on spreading. That's what you know about that. That kept on spreading till it got to the point where we had to remove the leg. And sometimes it can even worsen and it causes infection in the blood and sepsis come in and wahala burst everywhere scatter. So my appeal is there is a lot of wahala. This is established wahala with diabetes. So it's early detection. And prevention is the best way to managing this. I hope I have made sense and I've said.
Yes, you are making sense. Yes, you are making sense. It's just that the network is not. The network is checking.
Oh, sorry about that.
We can hear you very well. We can hear you very well, but your face is checking. But I don't see your face shine.
Sorry about that. But I just gave a brief intro and a brief highlights about the risk factors, the types. So my take-home message in this discourse is the fact that, number one, if there's anybody in your family that has diabetes and if you're at risk of having diabetes, please watch it. Number two, ensure that you watch your diet and do your exercises as much as possible. Now, number three,
but Nigeria, the way we hustle, do we need any extra exercise?
Hustling is not exercise. There's everything. Hustling is for daily bread, but exercise, hustling is
Rocky, I would say what you are telling us, the viewers, even in the Instagram and YouTube, I'm taking note of it now. But my problem is that, do you know that this morning, yesterday night, I was on my way to Kefi, from Kefi early in the morning, back to Lugbe, from Lugbe, back to Area 10. No, okay. And our office is in, like, 4-story building. I climbed that more than 4 times in a day. Did I need any, see, as I did like this, did I need any exercise?
It has to be holistic. It's only some part of the body that is working. The exercise we are talking about is every part of your body that is working. You've only been working on your legs. What of your hands? What of your other parts of your muscles? So
don't worry. I want to go and buy boots now. I want to go and start playing ball.
Yeah, as simple as jogging, as simple as just walk around. I know we could just. Maybe like when I was where I was in Abuja, you could probably, if you were Kubwa, for example, I can say just take a stroll from Kubwa Bridge down to Gwarimpa. Just take a stroll. It's to and fro. Maybe the Galadimawa Gate, the two sides. It goes a long way to actually exercise the muscles and everything. But that's my appeal. So at this junction, I think I have given a brief insight into diabetes mellitus, and I don't know if there's anyone that probably have some questions to ask. And if you have questions, I would be most glad to answer you.
Thank
But
you very
basically,
much.
that's just the major issues with diabetes, and as I said, it can affect every aspect, and it can actually affect the kidneys. We've had a lot of patients who are on dialysis in the long run just because the fact that they had to it competed as kidney failure, and they have to keep doing dialysis and talk about other stuff. So it's very very it's multi-systemic, meaning it can affect many systems in the body. So that's why it's really something out there for us to watch out for. In some developed times, the government takes over management of patients with diabetes. They ensure that the patients are well taken care of. But we are in Nigeria. Hopefully, the next election is going to change. Don't ask me who I'll vote for. I don't vote there. Well, you don't know what I'm rooting for, but hopefully the next election is going to cause a very wonderful change in Nigeria. Ah, Doctor, one of my chief is here. Thank you very much, Chief.
Okay, my bro, thank you very much for coming to the show. My own
Yeah,
question
thank you.
is,
Yeah,
uh, I my pop man have had the case of diabetes. I mean,
okay,
he's an old masher, but
okay.
later after checking, because after we discover, are you hearing me?
Very well.
After the test that to show up that he had diabetes, therefore he avoid some food.
Okay,
Do you know that we need to rush him back to hospital? They say he should go and take more sugar. And since that time,
okay,
he has not experienced it again. Is there anything that can cause it is around 80 something? 80, let
okay,
me say 80. It's that time that he has that issue was 80. It's 80. Because he's close to his 90 now. He's still alive.
okay. Thank you very much for the question. Now, there are people who, with diet, they will control their diabetes, the diabetes they have properly. I have to say it clearly because we once managed the patient back then during my internship days. The patient was not on medication. The patient was just on diet. So there are people who have had diabetic mellitus, and the major issue, what happened was with their diet, they controlled what they ate, they reduced high calorie diet. It helps them. So it could be the case that there's a very high chance that he worked on his diet. And I forgot to mention that some of us in Nigeria, we usually would overtake our drugs and we will now be having low sugar. Because to leave it out there, low sugar is worse than high sugar. Just to put it in context, low sugar can kill than high sugar. But back to the context. So there's a high chance that with his diet, he was able to control it. And people respond differently. The way I would respond is going to be different from the way you respond as well. So the fact is, you need to put that at the back of your mind. So what I would say is there's a high chance that with his diet, he was fine. You understand? But maybe
I'm with you.
it would probably need some further tests so that we'll be able to nail did he actually make a diagnosis of diabetes or not. You get the point. So
I
the
get the
thing
point.
is we need to just do some tests later, but it might now sometimes your sugar might be high just because that period you did stressful conditions and it now cause your blood to produce more sugar just to meet up with your energy demand. So that could also be, that does not mean you have diabetes. There are symptoms you must have and there are tests to confirm if the patient has diabetes. I don't know whether you
Okay.
get what I mean. So like
That
I
is where
checked my
that is
sugar
that,
and I don't
that is
have
where
my
I'm that is where I'm going. That is where I'm going to. Maybe that time the sugar is high and the result just show
yeah.
that the sugar is high. Because when I received the call that you have diabetes, me too, I don't the one that say this old man, wetin don't they get now?
Okay,
Later
I
after
get that
some
point.
but he is a man that since I know him, he watch what he eats. Somebody wants
Yeah.
me to bring him alive. Okay. He watch what he eats. My father watch what he eats. Even till today. I
Really.
can tell you, if you come and visit me, I do tell people that this man doesn't take anyhow food. If you talk about in food though, he's very disciplined in that. He eats more of this vegetable true.
Yeah, that's brilliant.
Okay, sorry, I'm bringing somebody online. Why?
Yeah. Okay.
Sorry, please, you can send me a request back. Maybe you have any question you want to ask doctor. But after that, he just, even later, he told me that there is one leaf he cut that time. I was like, this man, don't go and take anything that will harm you. I never get money for cow. You understand? I
Yeah.
was just thinking that sometimes, being when you have high blood sugar or any sugar, is not yet a strong diabetes. All this diabetes has grade.
Yeah. Sorry, I didn't get that question.
That is, diabetes has grade.
So, okay, well, there's a state what we call pre-diabetes. That one is those that are close to having it, but they don't actually have it. But I said this has to be made by
Like
clear
my father own,
diagnosis.
like my father own.
The thing is, if he, to confirm the test, yeah, he needs to do what we call a fasting blood sugar. Fasting blood sugar is the blood test that is done, blood sugar test done in the
In the
morning
morning,
before
ignore
he
it.
eats anything. You understand? And if he does it on two occasions, and or he does what we call a random blood sugar, and he has symptoms, he must have the symptoms, the three cardinal symptoms I've mentioned. Then we will not say okay, he has. But if he doesn't have this, that doesn't make him have diabetes mellitus.
Okay. Please, maybe I don't know your name. You send me a request. I try to bring you up, but maybe it's the network, or you do not want to show your face. Please, you can send me a request before doctor have anything to say again, because me, I'm a village man.
Very well. I mean, I'm open to any questions. If anyone has any
Please,
questions.
if you have any question, or doctor, I'm looking towards to open a email, so that maybe if there is any question in a previous and the current, because as our YouTube just starts, I've not opened the comment section, but by the grace of God, I'm going to open the comment section for now. As maybe I'll open an email for the Voice Health Talk. If there is any question, I'll forward the question to you before any of our show.
Yeah, that's fine.
Doctor.
It's fine. I'll be happy to give you responses as much as possible.
Okay. Doctor, apart from all what you have explained, the food, we should be careful of what we intake. Are you encouraging us now? Because one of your speeches, are you encouraging us to take more sugar? I can take like how many bottles of Coke per day?
Don't
So
you're going
that
to do
maybe
that straight
maybe
yourself. No, no, no.
as I dey carry water, I go dey carry Coke.
I'm not encouraging you, Oshiga. I'm just trying to debunk that. I'm not encouraged, but you should just be moderate. But you understand, just be moderate. But please keep drinking water, because even diabetic patients, they need a lot of water. So if you drink more water, you're not overstressing your kidneys, you're not overstressing your body. It helps a lot as well.
Okay.
Even
Wait.
when they come with some complications. There are some complications that I didn't mention. I mean, like the done that will cause them to lose consciousness and stuff like that. There are some very what we call diabetes ketoacidosis and other form of complications. These complications, part of the management or part of treating them is giving them water, not like water to swallow, but water through the vein. That's like the first line in management. It's part of the first line in management. So it's important that you drink your water.
Okay, but do we have any ratio of intake of sugar we can take?
I can't really say, but I just advise that if you take more of natural sugar, when I mean natural sugar from fruits, I mean those ones are safer. But
Like Debino, sugar cane.
yes, those ones have, I mean, good sugars that are very, I mean, they have good amount of sugar that will help your body as well, and they are
Sorry,
natural. Good.
sorry, maybe you are watching us outside of the country. Maybe I didn't. Maybe there is no anything called Debino. It's a local. It's Nigerian local. That is what we call it in Nigeria. Okay, thank you very much, Doctor. Doctor, it is good to have you.
Thank you
Sincerely,
very
I'm
much.
grateful. I've learned a lot. Even this water now, inside the car now, we have a lot. Putting
It's
water. If I
important, and
cannot get
we're
bottled
even
water,
going. It's important, particularly this season. We are going to dry season in Nigeria, and the sun and all. So drinking a lot of water is going to reduce, because you are just going to be losing a lot of water from different sources. There will be increased demand of water in your body. So drinking a lot of water this period, particularly in this dry season, is going to help you a lot and reduce the risk of overworking your kidneys.
thank you. Doctor, it is good to have you on the show. Thank you very much.
Yeah,
I'm grateful
thank you.
to
Thank
have
you
you.
for having me here. All right.
Thank you. Doctor, please can you introduce yourself once again before we close the show? It's like we do not have any
My
question.
name is Doctor Osas, but everybody knows me as Osas.
Osas,
So
Doctor Osas.
like everybody knows me as Osas, but that's right. And
Okay.
what else? I am a medical doctor, licensed practice both in Nigeria and in the UK. So that's all.
Wow. Thank you very much. Thank you, Doctor. My name
Thank
is
you.
Adewale. Adewale, the host of the show. Please follow us on Instagram, the voice underscore D DE underscore voice 12. Follow us on YouTube, DE space voice 12. Follow us on our Twitter handle also. Visit our website www.thevoice.com. Dr. Usas, we are grateful to have you on our show.
Thank
Please,
you.
we are very, very grateful. Thank you for this free Dr. Usas. We are see, I give you all. My regards to everybody. Everybody that has contributed to this show that have come on that have come on live to come and watch the show. We are grateful to you. You can share the video, share it on the YouTube. Thank you. I remain my humble self, Adewale. Bye for now. Dr. Osas, bye bye.